Ceramides in skincare. Many people have questions, and I'm doing a quick clip today. I'm going to talk about what they are, what they can do for your skin. Do you really need them? And I'll recommend a couple at the end should you choose to use them. The outer barrier of the skin, so important. I talk about all the time on this channel, the stratum corneum. This is the most common lipid found there. In fact, it makes up half of all the lipids in that barrier. People say, well, that's the barrier we're trying to get rid of. That's what, if we get rid of that, it gives glow. No, that's what keeps everything stable. So we have to take care of that barrier, and ceramides are a big part of that. Now, they're naturally occurring. So you might say, well, if they make up 50%, why should we take it? Why do we need extra? And the point is, we're talking on this channel about anti-aging. As we age, we produce less of things. The machinery doesn't work as well. Liken it to hyaluronic acid or collagen. The machinery doesn't produce as much hyaluronic acid, so that's why some people replace it by injections or topical. In this case, we're talking topical ceramides to keep that stratum corneum working, and it's often found in moisturizers. People negate this step of moisturizing, but even if you're using a hyaluronic acid serum as an example, that doesn't really moisturize. That needs moisture and water locked in for the hyaluronic acid to work. The moisturizing step is key, and that's where ceramides come in. Now, there are 9 types, and ceramides are a studied ingredient. In fact, people are going to see prescription grade products and ask why. Many things we find that work on the skin have been studied in disease states such as atopy, psoriasis, chronic skin conditions, allergies, eczema. And so this is where ceramides are well studied, and of course where we get the data to extrapolate to anti-aging mechanisms. Do you need the prescription one? No. The ceramides that we get over the counter can work well for people for anti-aging, but it is nice to know that it's a studied product. Those people who really know about the stratum corneum are those who use CO2 lasers back in the day, because we burned the skin and then let it grow back. Today we use fractionated type of lasers, but if you're doing any skin procedure, which many of you are on this channel, you're disrupting that skin barrier. And CO2 laser I bring up because it's one of the most aggressive things we use. 10,600 nanometer, targets water, it ablates. And so we're really getting rid of the stratum corneum. So for many of us who did this many years ago, and even now if you're aggressive with your treatments, we have to build the stratum corneum back. Ceramides can play a big role there. That's another area where you might say we're deficient in ceramides, and it can be used. Okay, so we know it's found in moisturizers typically. It's important for barrier function. Do you need it? The answer is not necessarily. I know some people like their ceramides, and if you like them in your moisturizing product, that's great. I'm a fan of them. I have my Ultra Moisture. There are no ceramides in it. It's mainly oils and extracts. It's a finishing cream, or kind of like a glass skin type of cream. Helps with fine lines, emolliates. But if you like ceramides in your product and you want to try them, it's always nice for the skin to see different things, and everyone's going to be individual in terms of how they like specific products. So they're worth trying. They are studied, they do work, and it will be a personal decision. The two I'm going to pick for you that my patients like and that I enjoy are not very expensive. So it's not like you have to spend a lot of money on them, and it's a bit of a luxury. You can use them once in a while, so often they can last people a long time. When your skin's acting up, you can try and add some ceramides if you have them lying around. One that I like is the INKEY List Hydrating Overnight Repair. It's a lightweight, it has hyaluronic acid in it. It can be used if one is using peptides, if you're using retinoids, if you're using growth factor. It can be added as the last step at nighttime. A lot of people like that because it is lightweight, it's not so thick, and it doesn't lend itself to acne. And a lot of people who are on retinoids are also on them for acne reasons. A second one I like is the La Roche Double Repair Face Moisturizer. I like it because it has niacinamide, one of my favorite ingredients, but it's also under $20, so it's inexpensive, it works well, and it plays well with other products like hyaluronic acid and peptides and retinoids. So remembering that it's your last step, I think that's key, because your serum should be first, and then of course any actives that you're putting on, and then this is more of a barrier moisturizing step, so you don't want to try and put peptides or retinoids or even growth factors on top of it. You want those more as your middle layers, and your very light serums is your first layer. So just recognizing that fact, these are both under $20, so very affordable, and I think it's good to have them around so you can try intermittently, and they will last you a long time. Ceramides, let me know, do you like them? I tend to use my Ultra Moisture more, but not a bad addition to a skincare routine, kind of like a luxury. Stay tuned here, keep your skin and body beautiful, healthy, and vibrant.